Hi everyone, my name is Cecelia Hollands and I work at the Barber National Institute as the Senior Clinical Supervisor for Barber Behavioral Health. I am also a licensed mental health therapist. Today I'd like to spend some time talking about anxiety, which I think is an important and timely topic, especially in light of all of the changes all of us have had to make as a result of COVID-19. So much of what we consider normal has changed in just 1 month's time. The way we work, the way we interact with friends, family, spouses, the way we're able to spend our free time, all of that is different now. There is no doubt that we are navigating uncharted territory, and that can feel really frightening. I think all of us are collectively asking ourselves, what comes next? For many people, the uncertainty around the coronavirus is the most challenging aspect of this entire situation. And because there is still so much that's unknown about COVID-19, it can be really easy to jump to panic or the worst possible outcome. With that being said, I thought it might be useful to discuss some measures we can all take to try to minimize our anxiety. So my first tip may seem pretty obvious, but one way we can try to minimize anxiety is to limit exposure to news or media outlets. Try to set aside a little bit of time each day, let's say 20 minutes, to get your news updates from reliable sources. This way you're still staying informed, but you're not allowing yourself to fall down the internet rabbit hole. My next tip would be to make sure that you're taking care of yourself physically and emotionally, and focusing on those things that are within your control, such as following hand washing guidelines, practicing good hygiene, or adhering to social distancing measures. Additionally, physical activity is a really important part of mental health. So, when you can, try to get outside for a short walk each day. If you can't get outside, there are many virtual workouts available on YouTube or on other online platforms. To keep anxiety at bay, try to find a little bit of time during the mornings or during the evenings to do some quiet meditation or deep breathing. And my third tip, remember that you're not alone. If you find yourself feeling more depressed or anxious, try to remind yourself that it's okay and that those emotions are both expected and normal during a time like this. For example, if you find yourself feeling distressed because you just can't stop worrying, try to accept that you are feeling worried without placing judgment or blame on yourself for feeling that emotion. Try to focus instead on ways that you can stay connected to the people you love. And if you wanted to take it a step further, you might want to think about ways that you can help other people in your community that might not have access to the resources or means that you do. Think picking up some pantry staples for your elderly neighbor or donating to a local charity. Actively doing something to help during a crisis can be really good for your mental health. I hope these tips were helpful to you. It's important to say that if you find yourself really struggling, it's best to reach out to a qualified mental health professional. Thank you for listening, and I hope you all stay safe and healthy.